Leg raise, flexion. Straighten your leg and contract your thigh muscle, then lift your leg off the bed. Do not lift your leg too high. Do not bend your knee. Do not arch your back. Keep your opposite leg bent to help stabilize your pelvis. Lift slowly for 2 to 3 seconds and back down for 2 to 3 seconds. Repeat 15 times. Leg raise, abduction. Lay on your side and make a straight line from your shoulder to your hip to your knee and ankle. Slowly lift your foot off the bed, moving it away from your other leg, then return it back to the resting position slowly. Keep your toes pointed forward. Do not kick your leg forward. Do not kick your leg backwards. Lift slowly for 2 to 3 seconds and back down for 2 to 3 seconds. Repeat 15 times. Leg raise, extension. Lay on your stomach with a pillow under your hips and knees bent at 90 degrees. Lift your heel towards the ceiling, keeping the 90-degree bend at your knee. Keep your hips flat on the bed. Do not twist. Keep your leg in line with your body. Do not come out to the side. Lift slowly for 2 to 3 seconds and back down for 2 to 3 seconds. Repeat 15 times. Leg raise, abduction. Lay on your side with your top leg propped up in front of you. Lift your bottom leg off the table and slowly lay it back down. Keep your toes pointed forward the entire time. Don't kick forward. Do not rotate your body. Lift slowly for 2 to 3 seconds and back down for 2 to 3 seconds. Wall squats. Stand with feet shoulder width apart and about 1.5 feet from the wall or door. Lean back and bend your legs to about 90 degrees. Then stand back up. Squat straight down and come straight back up. Do not lean. Keep your knees shoulder width apart. Stop at 90 degrees. Do not squat too deeply. Do not let your knees pass in front of your toes. Squat down slowly on a 3 to 5 count down and back up on the same count. Wall squat with ball. Place ball against door and lean with feet shoulder width apart against the ball, with your feet 18 inches in front of the ball. Squat down slowly and stand back up slowly. Keep your hips against the ball. Do not lean forward. Do not lean backward. Squat slowly on a 3 to 5 count and come up for the same count. Sit to stand. Sit in a chair with feet shoulder width apart. Slowly stand up, keeping your body in control. Keep your knees shoulder width apart. Do not lean forward. Do not push off your knees to stand up. Do not push off the chair to stand up. Try to stand up slowly over a 2 to 3 count and sit back down slowly over the same time. Single leg stand. Stand and balance on one foot and lift the other. Make sure there is something nearby to hold on if you lose your balance to catch yourself. To make this harder, you can bend your knee. If you feel like you're going to fall, step down with your other foot. To make this harder, close your eyes. Stand on a towel or pillow or another unsteady surface. Do not let your opposite leg touch the leg you are balancing on. Keep your ankle, knee, and hip in a straight line. Do not let your knee come in front of your toes. Single leg squat on a step. Stand on the edge of a step with something to hold onto for balance. Bend your knee slowly. Come back up slowly. Do not let your knee pass in front of your toes. Keep your hips level. Make a straight line between your hip, knee, and ankle. Squat down slowly on a 3 to 5 count and come back up under the same controlled time. Make sure you have something to hold on to for balance. Hamstring. Sit at the edge of the bed with one leg straight out in front of you and one leg hanging down to the side. Keeping your back straight, lean forward slightly until you feel a stretch in the back of your thigh. Do not arch your back. Do not bend your knee. Hold each stretch for 60 to 90 seconds and repeat 2 to 3 times. Quadriceps Stretch. Stand on one leg and bend the other leg so you are holding your ankle. You may need something to hold on to for balance. Hold the stretch for 60 to 90 seconds. Repeat 2 to 3 times. Hip Flexor Stretch. On the bed or floor, kneel on one knee with the other leg in front of you. Lean forward so that you feel a stretch in the front of the hip. Make sure that when you lean forward, your knee does not go past your toes. Hip Adductors. Sit in a butterfly position and bring your heels towards your body as much as possible. Let your knees hang down to the sides, stretching the inside of your thighs. Iliotibial band. Stand with your side towards a door or wall. Cross the outside leg in front of the leg closest to the door. Lean towards the wall, letting your hips fall away from the wall. You should feel a stretch on the side of your outside hip. Calf, Gastrocnemius. Stand with one foot in front of the other and lean forward, keeping the back heel flat on the ground and your knee straight. Calf, Soleus. Stand with one foot in front of the other and lean forward, allowing the knee to bend, keeping the back heel flat on the ground. Plantar flexors. Rest one ankle on the opposite knee, grab the toes and pull gently until you feel a stretch along the front of the ankle. Piriformis. Lay flat on your back with both knees bent and rest one ankle on the opposite knee. With a towel, pull your leg towards you. You can also do this without a towel by reaching behind your leg and pulling it towards you with your hands. Make sure you do not twist your back as you do this stretch.